Hey guys, Justin with ABR here. This week we had Katie from Kentucky down here. Katie is 13 years old and she's in 8th grade. She's heavily involved in sports as far as volleyball and basketball. She's been playing that pretty much for a few years now, a long time. So she was born with this congenital absence, is what we'll call it today. She's been a long time user of the Shriner system, using a prosthetic leg like this one here. So the limitation she had with this current prosthetic that she had prior to coming down here was just a lot of rubbing around her knee. She also had some pain on the bottom end of her leg. She, with the rubbing around her knee and pain on the bottom, she had to wear about 10 ply of socks as well. And with the 10 ply of socks, she still had a lot of migration of her residual limb inside of the prosthesis, and that created to rubbing and uncomfortable and sometimes pain. Another thing, she's very active in sports, volleyball and basketball, so it's a lot of high impact jumping and running. And so this is what she performed many years playing with. And so what you can see here is this is just a hard socket with I think a satch foot. And so this foot doesn't really have any give to it. It just has a nice rubber rollover, just a nice smooth rollover, but there's no energy return to it. On the heel, it's very firm. As you roll over, it's firm, and then it kind of just breaks over the toe to allow it just to roll over. So this is a good starting out foot for lower active people. It's a nice stiff foot that is very stable. But for people who are trying to be more active and do high impact activities, what we have found is sometimes a rigid foot does not decrease the forces on her leg. And so what we try to do is just allow her to be more active, address some of her concerns of rubbing, pain on the bottom, and the migration of her residual limb inside of the prosthesis. What we also noted is even with 10 ply socks, she can just fling her leg and the whole leg flies off too. And so, running and jumping, and also what she noted here is in basketball, people would step on her foot sometimes and her leg would come out of the prosthesis. So they have to stop and find the random leg on the court and put it back on. So it's not really ideal in a high-speed game situation. So do you mind slipping your leg off here, Katie? So Katie came to us, like I said, earlier this week. And take the P-light off too, please. And we'll take the sock off if you don't mind. So this particular prosthesis, we're going for anatomical suspension. So the reason why we're going to anatomical suspension is due to the bulbous nature that she has distally. We believe this to be a Boyd amputation, so she has her calcaneus and talus down here, as opposed to a Syme's amputation where you just have a heel pad and you have a tib fib right here, and the heel pad can move sometimes, creating bony prominences on the medial and lateral malleoli. Luckily for us, she has bony anatomy down here, and she can actually stomp on the end of her leg without pain. And because of that, we're able to take advantage of this amputation and allow her to load down here, and we're able to suspend down here. And when we're able to suspend down here, we can get rid of gel liners. Gel liners, they're nice when you need them, but if you don't need them, then we can decrease sweating, we can decrease cost, and we can decrease weight as well. And so what we were able to do is she was already in a sock system. With this hard socket. There is no flexible inner on the inside of here. It's a soft foam, about proximal only, and then she has a distal end pad on the bottom. So this holds on through a little bit of friction, a little bit of maybe some anatomical suspension, but basically some stocks, stuff in there, and hope that it holds on a little bit. And so what we're able to do with her is, because of her anatomy down here, we really made an effort to lock on posteriorly where it's more bulbous on the posterior aspect there. So we did over skin measurements, cast it directly on her skin, and we modified the mold just to lock on distally down here. And so in her old socket, she was putting on 10 ply of socks, and on this one, she just puts on, she just wears this gray sweat wicking sock. This is kind of like a 2 ply sock right here, but ideally for us is the sweat wicking moisture of the nature of this sock here. And so she just puts this sock on, she puts this foam insert on, slips down in there. She has a sheath on there just to decrease friction to slide in here. And she just steps into her prosthesis, and then go ahead and try to kick it off real quick. And when she kicks it, it doesn't fly off anymore. And so, you can done kicking that, thank you. So the main thing what we did here is, you might notice that there's a foot mounted on the back. So it's very common that people around the country, they are trying to get their patients more active, but they may not be aware of some posterior mounted options. And so instead of duplicating what you have with a distal foot that's very stiff and rigid, we're able to use a more dynamic foot that has a lot of compression and energy return to it as well. So although people might think build height is an issue, there really is no issue if you just get a foot to mount it on the back. And there's a couple of manufacturers that have products like this. And a little trial and error and a little bit of patience, you're able to get the alignment you want, educating the patient how to use their muscles a little bit more to take advantage of a foot like this here. Let me take this off real quick here. So we're going to pop it off real quick. I just want to show you. So when she comes down, there's some more heel compression here. And also rolling over, she has bounce in the foot now. So one thing she was kind of found challenging to do was left-handed layup. So we're looking to see when she goes home what the differences she finds when coming off on something like that versus coming off on something like this here. So we'll go ahead and put that on here. And so we also educated her on different sock ply. When she is going to be doing sports, we're going to probably add an extra like 2-ply socks on the outside of this P-light just to, with activity your limb does shrink up a little bit. So we educated her on how to do that. And she has plenty of socks to manage her fit. The main thing here is we were able to, we weighed this is 3 pounds, and we weighed this one, this is 2 pounds. So we're able to shave a pound of weight off of her prosthesis. Doing this very similar design here as far as anatomical suspension and some sort of P-light and socks. But just a different design method, different foot option. We're able to decrease the weight of the prosthesis, and that just translates to sustaining longer runs, less energy consumption on the patient. And also not dragging weight along all day long will just be more comfortable for her overall. We also were able to, I'm going to take this foot out of here. So in that foot shell there, she would go in the water and it would get wet, and then sometimes there's a sock in there and it can actually just deteriorate a little bit. So we have this crepe cover here that's really easy to get out of the shoe today. All right. So instead of a foot shell, we're able to put crepe onto the foot. And this is a Vibram sole on the bottom down here. And this is just a puff top layer there just to fill out the shoe. So now she's able to go in the water. You don't have to worry about foot shells getting holes in them. You don't got to worry about the Spectra socks sitting in the foot shell getting mold on it. So it's really easy to use walking barefoot, going in the water. It's more serviceable. And so also, we might notice about this foot, there's a slot in it. So if she grows in the next year or two, we're able to loosen 2 bolts and increase the length of the prosthesis. We find patients at this age, they grow in length quicker than they do grow volumetrically. So this is a really good foot to adjust the height. You can see it might be very difficult to adjust the height on something like this here without having to redo the whole cosmetic cover there. So like I said, we're able to decrease the weight by 3 pounds, give her a more springy foot to allow her to do more activities. With a springier foot, it also decreases the forces that go directly on her residual limb. So she hasn't been having any discomfort on the bottom end of her leg anymore. We're able to kind of contour this socket up here approximately to decrease the pressure around her knee, but still give her a nice intimate fit for some knee stability. And we're looking forward to what she does when she goes back home. The biggest changes don't occur here in Nashville. They go home. The biggest changes are when they go home and start enjoying activities and get into a normal routine. So we're looking forward to see what Katie does when she goes back home. And I'm hoping for the best. And I'm happy to work with you, Katie. Thanks for coming down. All right. A little bit. Maybe just stand this way here. And you can see a lot of the, stand in one spot and just match on that toe like we showed you before. So you can see there's a lot of compression in that. And we had her run up and down the stairs and up and down ramps, and I think she liked the feeling of this foot compared to her old foot. Katie's a very smart girl, so I'm going to have her put her on the spot. And Katie, what are some pros and cons, or we'll just say pros. What are some pros that you've noticed about this foot and this prosthetic compared to your old one, Katie?
It fits so much better than my other one, because my other one, it was pretty loose because it was really loose inside, and that's why I wear 10 socks. And so for this one, all I have to wear is the sheath and this thin sock, and it fits so much better. And since that I can take this out, it's able to be tight, but it's comfortable. And it also allows me to have so much more bounce, and I can actually do a left-hand layup now because I can actually go off and jump off of this. And it's also cool looking too.
Most importantly. All right. I think we're all right, so for demonstration purposes, we're just going to do a quick swap of old prosthesis and Gait and new prosthesis and Gait. Specifically running Gait. So another thing too is she's had some bad habits with this prosthesis, and you know, when you are running on something as stiff as this and heavy as this, you have to accommodate. And she's done well over the years accommodating her gait pattern, and so we're still working with some of those habits that she has from this old prosthesis, and a lot of that won't happen overnight. It'll happen over the course of a couple weeks and months. It's hard to undo years of bad habits in a week's time frame. The main thing you might notice is when she runs, she likes to internally rotate her toe. A lot of that is because they use their adductors to advance their leg versus their hip flexors, and when you use your adductors, your leg will go sideways versus coming straight forward here. And so this is how she put on her old prosthesis. And then we'll just stand up right here out the door, and we're just going to get a quick jog to that skeleton back there, all right, Katie? All right. Prosthesis, and she's going to run. All right, good job, Katie. Thanks for your patience with us this week.
That was awesome.
We'll see you later.